Have you ever felt that familiar stuffiness in your head, the pressure behind your eyes, or that relentless tickle in your throat? You might immediately reach for a decongestant, assuming it's just another sinus infection. But what if it's something else entirely? What if the real culprit is histamine, a chemical messenger in your body? It's crucial to understand the difference between sinus issues and histamine reactions. Misdiagnosis can lead to ineffective treatment and prolonged discomfort. By learning to differentiate between these two common conditions, you can empower yourself to seek appropriate care and find lasting relief. Sinus issues, often referred to as sinusitis, occur when the air-filled cavities within the skull, known as sinuses, become inflamed. This inflammation can stem from various factors, with viral infections being the most common culprit. Other causes include bacterial infections, allergies, and even structural abnormalities within the nasal passages. Histamine, on the other hand, is a chemical released by our immune cells in response to allergens or irritants. Think of it as your body's alarm system, sounding the siren when it detects a potential threat. While histamine plays a crucial role in protecting us, its release can sometimes be excessive or inappropriate, leading to a cascade of reactions we experience as allergies. Understanding the underlying mechanisms of both sinus issues and histamine reactions is key to differentiating between them and seeking appropriate treatment. While both sinus issues and histamine reactions can share some overlapping symptoms, there are key distinctions that can help us tell them apart. Sinus infections typically manifest with facial pain or pressure, often concentrated around the forehead, cheeks, and teeth. This pain may worsen when bending over or lying down. Other telltale signs of sinusitis include nasal congestion, thick yellow or green mucus discharge, and a reduced sense of smell. Histamine reactions, on the other hand, tend to involve more widespread symptoms, often affecting the skin, eyes, and respiratory system. Sneezing, runny nose with clear, watery discharge, itchy and watery eyes, skin rashes, and hives are common hallmarks of a histamine reaction. In more severe cases, individuals may experience swelling of the face, lips, or tongue, difficulty breathing, wheezing, and a drop in blood pressure. Understanding the triggers behind sinus issues and histamine reactions is crucial for both prevention and management. Sinus infections are often triggered by viral infections, such as the common cold or influenza. Allergies, particularly to airborne allergens like pollen, dust mites, and pet dander, can also trigger sinus inflammation, leading to allergic rhinitis. Other triggers for sinusitis include structural abnormalities, such as a deviated septum or nasal polyps, which can obstruct airflow and promote mucus buildup. Histamine reactions, on the other hand, are primarily triggered by exposure to allergens. These allergens can vary significantly from person to person, with common culprits including pollen, dust mites, pet dander, mold spores, insect stings, and certain foods. The duration of sinus issues and histamine reactions can vary depending on the underlying cause and individual factors. Acute sinusitis, often caused by a viral infection, typically lasts for a week to 10 days. However, if left untreated or in cases of bacterial infection, sinusitis can persist for weeks or even months, becoming chronic. Histamine reactions, being primarily allergy-driven, tend to be more immediate and short-lived. Symptoms usually appear within minutes to hours of exposure to the allergen and may last for a few hours to a few days. Identifying and avoiding triggers is crucial for managing both acute and chronic symptoms. Accurately diagnosing the underlying cause of your symptoms is essential for effective treatment. If you suspect you might have a sinus issue or a histamine reaction, consulting a healthcare professional is crucial. They will start by taking a detailed medical history, asking about your symptoms, their duration, any triggers you've noticed, and your medical history. For suspected sinus issues, a physical examination of your nose and throat will likely be conducted. The doctor may use a lighted instrument called a nasal speculum to visualize the nasal passages and check for signs of inflammation, swelling, or blockage. To diagnose histamine reactions, allergy testing is often recommended. This can involve skin prick tests or blood tests that measure the levels of allergen-specific antibodies in your blood. Treatment for sinus issues and histamine reactions aims to alleviate symptoms, address the underlying cause, and prevent recurrences. For acute sinusitis caused by viral infections, rest, fluids, and over-the-counter pain relievers can help manage symptoms. Saline nasal sprays can also be helpful in rinsing the nasal passages and reducing congestion. In cases of bacterial sinusitis, antibiotics may be prescribed. For chronic sinusitis, a combination of treatments may be recommended, including nasal corticosteroids to reduce inflammation, decongestants, and in some cases, surgery. For histamine reactions, antihistamines are the mainstay of treatment. Antihistamines are available in various forms and can provide significant relief from sneezing, itching, and runny nose. Sinus issues and histamine reactions can be associated with other conditions, and understanding these connections is important for comprehensive management. Chronic sinusitis, for instance, has been linked to other respiratory conditions such as asthma and chronic obstructive pulmonary disease, or COPD. Histamine reactions, being a manifestation of an overactive immune response, can also be associated with other allergic conditions such as eczema, food allergies, and asthma. Individuals with one allergic condition are more likely to develop others, suggesting a shared underlying immune dysregulation. Both sinus issues and histamine reactions can significantly impact quality of life. Seeking timely and appropriate treatment is crucial for managing symptoms, preventing complications, and improving quality of life. In conclusion, while sinus issues and histamine reactions can present with overlapping symptoms, understanding their distinct characteristics is crucial for accurate diagnosis and effective treatment. By recognizing the different triggers, symptom patterns, and time courses, you can better communicate your symptoms to your healthcare provider and work together to develop a personalized management plan. You can take control of your health and find lasting relief from the discomfort that sinus or histamine issues can cause.